Hi, friends, and thanks for listening to The Fashionista Life, brought to you by True Fashionistas, where you can sell, shop, and look fabulous. I'm your host, Jennifer Johnson, and today we welcome in Dana Zeitler, and she is a certified physician's assistant who has specialized training and experience in facial sculpting and fillers and laser rejuvenation treatments, and she owns DeLux Med Spa here in Naples. Welcome.
Thank you so much. I'm so happy to be back, Jennifer. Thank
I
you.
know. It's so awesome to have you back. Our listeners learned so much from our last podcast together that I just knew I had to have you back in here so we can talk some more real talk. And I say real because a lot of times there's so much fluff out there. You can read something in a magazine and get all excited about it, and then go to somebody and then they feed you just a bunch of baloney, right?
Absolutely.
And you don't know who to listen to. So we're kind of dishing the dish and talking the real talk.
I love that. And I think that that's so important because sometimes, even as injectors, the manufacturers will sell us as injectors products, and we get so excited about it coming down the pipeline and what it's going to do. And then it doesn't necessarily pan out. To be as wonderful as what we thought it would be. And you don't know until you use it.
Right. It's kind of like the wah
Yes.
moment where it's Christmas morning, but you
Yes.
didn't get what you wanted.
Yes. So which new products do you want to talk about?
Well, I want to talk about Quo. That's QWO, because I read about it in, again, like one of the magazines. And I was like, oh my gosh, I'm so excited about this because I have cellulite.
Yes, almost, a lot of people do. It has nothing to do with weight. It is little fibrous bands that are pulling in the skin, and you have to break up those bands to get rid of the cellulite. Has nothing to do with fat. I mean, you can have skinny people.
I've seen it on really skinny people, and it looks like cottage cheese on your butt or on your thighs.
Yeah.
I mean, that's
it's
what
a
it
huge
looks like.
concern for many, many, many women.
So Quo. So I've heard, that it's amazing. It's wonderful. It gets rid of your cellulite. Should I do it?
So I think that it depends. It's very easy to do. It's pretty painless.
And it's a
super
shot,
simple.
an
It's a
injection?
shot. It's an injection. It's FDA approved for the buttocks right now only. We can use it off label in the thighs, but it's FDA approved for the buttocks. Takes about 5 minutes. So super easy, pretty painless. It does cause some significant bruising after the treatment, and you do need to do it a few times. Usually it's about 3 treatments spaced about 3 or 4 weeks apart for best results. And the biggest thing that I have seen is fairly severe, I would say severe, significant bruising. So I need to warn patients about that. And sometimes that bruising can last a little bit longer than we would like. But it does I've been very impressed with how well it gets rid of cellulite so far.
So how do I want to say it? Does it last, or do you have to keep doing it? Like we've talked about Botox where you have to keep doing it every 3 months. Do you have to keep doing it, or is it like a one and done, or like you said, maybe 3 treatments, but am I done with it then and it's going to go away and never come back?
Yes. Theoretically, once you get rid of the cellulite, it will be gone. Now, during our lifetime, our weight will fluctuate, our body fat composition will fluctuate as we get older, but it is not something that you have to keep doing every 3 or 4 months. You do your 3 treatments, 4 treatments, however many it takes to get rid of the cellulite you have, and then it should be permanent.
But we can bruise significantly.
You can bruise pretty significantly. And I've had some people that bruise just for a couple weeks and then it goes away. And I've had other people where the bruising lasts a little bit longer.
Okay.
Usually that tends to be determined by skin type. So the people with a little darker skin type, their bruises might last a little bit longer.
Okay. So now, I don't know if you remember the show Ally McBeal. Do you remember that show?
I do remember. I'm trying to picture it in my mind, though.
And now I'm laughing because the next procedure that we're going to talk about involves the waddle. Because one of the characters on the show had a waddle, and one of the other characters was very attracted by it. And I'm just laughing because
they could be cute, sort of.
Yeah. So Kybella, is that how you say it?
Kybella, yes.
Kybella. So tell us what that is. Does it work? Who should or shouldn't do it?
So Kybella is an injectable also. Kind of everything that we're talking about.
Almost
is injectable. So Kybella is an injectable. You can put it into smaller pockets of fat. So the little fat pocket underneath our chin is a perfect place to put Kybella. And what it does is it makes the fat globule sort of explode.
Mhm.
And then it takes your body about 10 days to metabolize that fat and get rid of it. So it is permanent, but it does take several treatments, ideally, for best results. So you would do those, maybe once every 6 or 8 weeks, and you get permanent reduction of the fat where it's injected. But you have to do it kind of over and over again, versus there are some other procedures, surgical procedures, that are a little quicker to get to from point A to point B. But the Cabela is really easy because you can do it in the office.
Right. Can you do it in other spots? And I'm thinking, like, you're gonna laugh at me. When you wave at someone, the underarms, how they just kind of flap in the wind. Can you do it under there, or does that not really work under
You
there?
could, but usually that is skin laxity versus actual fat under there.
Okay.
So I would probably choose a different procedure.
Mhm.
Now, for Kybella can be put in the bra fat.
Oh,
So
didn't think of that.
So I have had people, because that's a small little pocket of fat.
Mhm.
So I think of Kybella for small, tiny little pockets, because it is expensive. Just like Botox,
Mhm.
it's not inexpensive. So it's best used in tiny sort of little pockets. So some people have they call it a banana roll underneath
sure.
their buttocks. It's just a
Mhm.
small little pocket
Oh,
of
I
fat
know
there.
what you're talking about.
So that's a very popular area also for Kybella.
Oh,
So
wow.
little tiny pockets.
Mhm.
So the chin, usually it's a small area. So that's going to get the best results, versus a larger area. I would say it's a better option to do surgery.
Okay. And I know at another episode we were talking about sagging,
Mm-hmm.
right? And
Yeah.
sagging of our face, and I look at myself again. We are our worst critics.
Yes.
I know that, right? But there's this area that I'm looking at on my face right here. That I feel like it's just kind of going downhill. It's going down south. I don't know what's going on with it. Is that skin? Is it the sagging part that's happening? And can I fix that?
So there are lots of things that you can do, lots of options for
Mhm.
everything. So one option that we do in our office is something called it's called jawline Botox and neck Botox. And we can put a little small amount of Botox. Again, we don't want to affect the muscles
Mhm.
too much. Just on the upper part of the jawline and the lower part of the jawline, and into these little neck bands that pull down on the jowls or
Mhm.
where you're sagging, and it kind of releases it up, and you get a small little tiny facelift. There's also, you can put some Botox. We have these puppet lines, or the marionette
Mhm.
lines, where when we make a sad face or we frown, they pull the mouth downward, and you can actually put a little Botox in there so that you can't frown. So I actually have some on board right now, and I'm going to try to frown for you. So this is me trying to frown. So you see
Oh, yes.
how I can't really do it. It
Right.
doesn't make me look different or
No, it
weird,
doesn't.
but I really can't make that sad face or that. So I just look happy
Mhm.
all the time.
Hey, that's really awesome.
It is
It
kind of awesome.
is.
So, but that's what we can offer. It is not a surgical result,
Mhm.
but it does help lift the face a little
Right.
bit. And the other thing that sometimes we can do is we can put a little bit of filler in the cheek. So as we age, our fat pad in our cheek kind of deflates and gets pushed
Mhm.
down, and it creates those marionette lines and the nasolabial fold. So if we put just a small amount of cheek filler, we can reinflate that back up, and buy
Mhm.
some time for make you look a little refreshed, a little lifted,
Right.
and maybe put off a facelift for another few years, 5 years, 10 years, or not at all,
Right.
depending on what your goals are.
No, we were talking before we got on air about possibly a new product coming on the market. And by the time this podcast airs, it may be out at that point. I do not know. But what is that supposed to be?
Oh, yes. So there's a new neurotoxin or wrinkle relaxer coming in the pipeline. It's called daxibotulinum toxin. And
say that twice.
yes,
Once.
they're calling it Daxi for short. I honestly, I don't know what the name brand, what it will be, because Botox is onobotulinum toxin. So it's being called Daxi right now. So it may have a different name when it comes out. The maker is called Revance. Their headquarters are actually in Nashville.
Oh, wow.
So I know you have some connection with
Yes.
Nashville. It's a beautiful, beautiful office in Nashville. Anyway, they have a 6-month longevity. So for people that that do Botox regularly
Mhm.
and they know that they like it and they want it to last longer, it's going to be really exciting to have that longer longevity. Also, people that get TMJ Botox in the masseters, that is very exciting.
I've
because
actually done that because I grind
you
my
clench,
teeth
yeah,
and clench, and it's terrible.
Yeah, for those type of people, it's going to be a wonderful option for having a neurotoxin that lasts a little bit longer, and some of the medical things that are treated with Botox. I don't do a lot of those in my office, but I think it's going to be a real game changer for the industry.
Wow, that is wonderful to know. With the kids headed back to school, you may have a little extra time on your hands to clean your closet and maybe theirs too. Or hey, maybe you even have a little bit of time to redecorate your house. If you're wondering what to do with all that stuff that you've accumulated, bring it all to True Fashionistas, where they sell your unwanted items for you. They take away all the hassle by doing all the work, and all you have to do is sit back and collect your money. You can reach out to them online at truefashionistas.com. Come into the store or check them out on Facebook or Instagram, and that's truefashionistas.com. We are now back again with Dana Zeitler, the owner of DeLux Med Spa here in Naples, and we are talking about injectables and beauty, and we are being honest and open, and it's real talk.
I love it.
No fillers, but bump.
Absolutely. No fillers.
Sorry. That was a really bad joke.
That was
Jennifer.
awesome. I love that. I wasn't ready for it, but I love it.
I wasn't either. It just
Came out.
So I have to laugh because, a lot of times we'll see, like, I think of Joan Rivers. Okay. She obviously had a lot of work done to her face, but then you just start going down her body and you see her neck or you see her hands. The hands always give it away.
They do.
It's like the
manicurist knows.
They do. Or, the ladies will wear the long sleeves so you can't see their hands. But what can we do about that? What can we do about our hands aging? I know, obviously sunscreen, right? But I forget about that.
And they have gloves now you can get too for covering the hands. Yeah.
Oh.
But in our office, we usually approach the hands first with a laser. We have something called BBL Hero, and it is a light-based laser that goes after the little brown spots on the hands.
Oh my gosh.
Those age spots, yeah. And it's magical. It just it gets rid of them. So that's my number one, because if you can clean up the pigment on your hands and you get rid of some of that sun damage, it can really make your hands look fresher, brighter, clearer. We can also use fillers in the hands.
Really? Oh my gosh, I never even thought about that, because your hands lose fat.
Your hands lose fat. Some people don't like that they look a little veiny, or you can see the little ligaments, which can so you can plump them up with some filler. It looks so between the laser and the filler, you can really make a big difference in your hands.
So you mentioned basically it's melasma. Is that what that is on your hands, or is that more my face?
Melasma is a condition that where you have extra pigment that comes in patchiness. Sometimes it happens during pregnancy.
Like you can see on my face right now because I've had too much sun, even though I've worn my sunscreen.
Yeah, if it's sun damage is different than melasma.
So it is. I thought they were the same thing.
Yeah, two totally different things. But so on your hands, it's usually sun damage. It's usually from when we were kids, wearing iodine and baby oil, or just not covering up and just getting a little bit too much sun exposure, or going to tanning beds, God forbid.
Oh my God.
Back in the day.
I'm not going to say if I did that or not. I did for a little bit.
So, but you can undo a lot of that damage with some laser treatments.
I'd never even considered that you could do it on your hands.
Yeah.
And I
Mm.
learned something today that what I have on my face is not melasma. It's skin, it's from the sun.
It
'Cause
probably
that's
is. It probably is. If it didn't come out during pregnancy, and I'd have to look at you really
yeah.
close, Jennifer, because I can't.
I'm
I'm
like
having a tough time
I'm like,
seeing.
diagnose me while I'm sitting across the table from you.
But sun damage very easy to address with
Mhm.
laser, and you can really honestly reverse a lot. It doesn't, not necessarily in one treatment. Sometimes
Mhm.
you need a few treatments, but melasma is a condition. It's kind of like acne or rosacea that is a lifelong condition that you have to try to control.
Okay.
So two different issues.
Got
And
it.
if it's true melasma, I actually don't put people on the laser for melasma. I usually treat them with peels and topical creams
Mhm.
and strict sun avoidance hats and sunblock.
Okay. Now, going down the body,
Okay.
or I guess up now again, because we were just talking about hands, the chest.
The chest.
I've seen crepey, I've seen, really severely what looks like sun damage. What can be done about the chest area?
Well, I want to go shopping and, at your place and get a little scoop neck or off the shoulder. No, I mean, we don't think about our chest. You're
No.
you're right. And we do show it off. People will go to plastic surgeon and get new implants and
Mhm.
they don't do anything about their skin on their chest. And then
Mhm.
they're wearing all these low cut things. And I'm like, let's work on that skin,
Right.
girl. So laser number one, to work, same thing as the hands, to get rid of that brown pigmentation and blotchy skin. Huge. It's life changing, honestly. You didn't realize how good your skin can look on your chest and your neck. And also, you can do a little Botox in the crepey skin.
Oh, I
And
didn't know that.
there's some other injectables that are collagen stimulators that you can use in the chest as well to thicken up the skin, and it also works on that crepiness.
What about on the neck? So, as I'm sitting here, I can't see myself, but the little lines that you get in your neck just from maybe, you have your head down while you're
Looking
on
at
your
your phone.
phone, right? But I've noticed those on myself. Can you get rid of those?
Those are tricky. Best served by holding your phone up
Mhm.
and trying not to bend down so much. But yes, you can put some Botox in there and soften them. You can put small amounts of filler, but I find that the best thing for that is laser. And those are really hard to do. I don't like to put filler in them. There's a new filler coming out soon called Redensity. It's actually coming out in a few weeks. It'll be out by the time this
Okay.
podcast airs, and it's supposed to be really good for necklines. So I haven't tried it yet. I haven't gotten my hands on any, but I'll August 9th, I will
Okay.
get my first delivery of that, and it is supposed to be really good for those little necklace lines.
Oh, I want to know.
Yeah.
I want to know.
Because I've been a little disappointed with the other fillers that are on the market currently for necklines. We can improve skin quality with collagen stimulators. We can improve skin quality with laser, but those deep lines from bending down, I'm excited about this new filler coming
Mhm.
out to try it and see if it works.
So you just brought up collagen, and I just had a fleeting thought in my head, like I always do. But collagen drinks and all this stuff are like all the rage. People are, I just saw some at Publix yesterday when I was going by the health aisle, and they have a little cooler on the end cap. And I saw this pink drink that was a collagen. Could that possibly work? Have you ever tried any of that, or do you know anything?
I have, and I'm actually using some now, to be honest. I had some COVID hair loss
Okay.
from post COVID or hair thinning,
Mhm.
and we sell a product in our office called Nutrafol that has a collagen supplement, and I had been very questioning
Mhm.
about collagen supplements because some of the colleagues that I highly respect don't think that they work at all.
Mhm.
So I kind of wanted to see for myself, and I do think there is possibly something to it because my nails are better, and my hair is definitely not falling out as much as it was or thinning as much from the collagen. But I think you have to take it with a grain of salt. It does add
Mhm.
calories, and I don't know the science that I have seen has not proven beyond a doubt that you get that much improvement in the collagen in your skin from the supplements.
Okay.
But my nails are definitely better. So
If anything, you have better hair and better nails.
talk to me again in a few months and we'll see, because I just started it.
Okay.
But I think that it's questionable. I don't think it's going to hurt you. It might help a little bit.
Mhm.
But the data that I have seen is not completely conclusive. My own impression so far is my nails look better, and I'm
Mhm.
going to put it in my coffee in the morning.
Perfect. Awesome. So now let's say in the journey of people going, you know what, I need something. How do they find somebody that is reputable and someone that they should work with? What should they look for?
I think recommendations from friends that are seeing somebody that they like, and if your friends look good, I
Mhm.
think that's probably the number one. I guess you call that word of mouth,
Right.
right?
Mhm.
That's probably the number one way to find online reviews. Also, are testimonials are important. Experience,
Mhm.
looking for credentials. You should see a medical provider. These are medical treatments.
Mhm.
So
Right.
somebody that is a medical doctor, a PA, nurse practitioner, somebody that's credentialed and hasn't just gone to a weekend course to
Oh my
learn how to
gosh.
do it, and they're doing it on the side.
Wow.
The other thing that I think is really important, I think people that do it full time.
Mhm.
So not somebody that's just doing it on the side as a hobby. You're
That's
going
scary to think,
yeah,
right? That you're gonna let them put a needle in your face.
yeah. I mean, you can go, I think physicians are extremely well trained,
Mhm.
and, I'm married to one. I love them. I have two in my office.
Mhm.
But there are physicians that go for a weekend course and then they put a sign up in their office that they're
Mhm.
offering Botox. And that doesn't mean that they're experienced in Botox. So, you want to go to somebody that does it all the time.
Right.
Plastic surgeons, dermatologists, most medical spas that are reputable, they're going to have full-time injectors. They're
Mhm.
doing injectables all day long, day in, day out. They've seen complications. They know what to do. And you want to look for somebody that is an advanced practitioner,
Okay.
ideally. Other states allow RNs to inject, but state of Florida is an advanced provider state. So MD, PA, nurse practitioner,
Okay.
DO.
Wonderful.
Yeah.
That's all great information. Dana, if our guests want to get a hold of you, how can they do so?
So they can call or text the office. Do you want me to give the number?
Yeah, absolutely.
Okay.
And the website?
Okay. Our phone number is 239-776-4956. And the website is www.deluxemedspa.com. There is no E. It's just DLUX
Okay.
medspa.com. And they can find me on Instagram at Naples Beauty Injector.
And I love
So
watching those, by the way. They're
thank
so
you.
cool.
We have fun. We have fun. So, and I love watching your fashion stuff. I love it. I love seeing you and your girls model your clothing.
It's a fun thing to do too.
Well, you look
Yeah.
adorable in
Oh,
everything.
thank you.
So,
Oh, thank you. Thank you so much again for being on our show. I know that our listeners have learned a lot.
I hope so. Thank you for having me.
Absolutely. And thanks again, friends, for tuning into the Fashionista Life with Jennifer Johnson, brought to you by True Fashionistas. Make your day fabulous.